A warm welcome to all our viewers, to our series Natural Medicine Today. Today we will talk about why high blood pressure can also be healthy and what does high blood pressure or low blood pressure even mean. And I am very happy today that I have the medical director Professor Dr. Thomas Rau with me. And I am also happy because he simply has had all-round specialist knowledge for so many years, also in holistic medicine, that exactly this topic, what it really depends on today with high blood pressure, is looked at holistically. Stay tuned. Hello dear Thomas, thank you for coming.
Thank you very much for having me.
High blood pressure is really such an issue. So I have the numbers in Germany. 65% of men have high blood pressure by the age of 40. And first I would like to ask you, this current blood pressure, the standard value, does it also correspond to the standard value that you perceive, which is also a healthy body, because there are also stories that there used to be other standard values that were not linked to the pharmaceutical industry, let me put it that way.
Yes, I always have to be careful with such topics that I don't start to polarize people. And I'm an extremely experienced doctor and have been in practice for 40 years, 42 years even, and I've really seen thousands of high blood pressure patients. The so-called normal values have been continuously reduced and are today, the upper limit 135, 145, so depending on age, the lower 80, 85. The patients I see in my clinic today are just the sickest people. Why are they coming to me? Because they are sick? They almost never have normal blood pressure values, but the normal values are not adequate. The answer to your question is today's normal values of blood pressure are not normal. They are set too low. Now you could say, well, these are just ideal values. Yes, but we are not talking about ideal values, we are talking about normal values. And at what age is which value normal? So values in adult humans, 45 and up or so, we see it at about 155 and the lower 90 to 95. So today every medical doctor shudders when I say that. But these are the values in patients who come to us. But they come for completely different things.
They are ill. It would be interesting if I now have a 40-year-old who is actually healthy. What is its value? So I'm always interested in the values of the healthy, because they also give a bit of an example. So maybe a healthy 40-year-old also has a normal value of 140.
All over the world, medical world, it is like that the normal values are defined due to a large statistical experience with the Gaussian curve. And the normal values must be in the 67% of the sine curve. This is really a standard value definition. This standard value definition for blood pressure and cholesterol normal values, which are no longer normal values at all, is not complied with. That's just not scientifically correct. We have a lot of people coming. Health-conscious people who come to us, they eat healthy and they want a checkup. We have quite a lot of checkup patients. A comprehensive checkup, not such a stupid like in academic medicine. I can go into that later. And then we take everyone's blood pressure. And not the doctor, but the nurse in context with the admission. That's on purpose that it's not with me. because with the doctor it's even higher. And they don't have normal values, because they have values that would be normal values. Namely about 135, 145, maybe 150. And the bottom 90. But I can go into the importance of blood pressure later. I think then it becomes clear.
We can also do it directly now. What does blood pressure actually mean?
I tell the people with high blood pressure that come to me. And of course, we have a lot of them. They come from the family doctor and they don't want to take the medication anymore, or from the so-called specialist and no longer want to take these antihypertensive drugs that they simply get and come. Do you have another way? What am I saying to these people? Now that sounds a bit provocative. Congratulations, dear patient, that your body is still telling you that you have high blood pressure and allows you that. Because there's something what tells you the kidney then produces renin, blood pressure rises. It can all be explained by hormones that an improved microcirculation must be ensured. In the kidney, in the adrenal gland, in the brain, or God knows where they do not have enough microcirculation. What is the body doing? Well, we have to increase the pressure. I then explain to the people. Do you have a garden where you can use the hose, the shower, to spray the plants? Imagine, you would have to spray crude oil. You need more pressure, otherwise nothing comes out. And you do that with your finest vessels. It just doesn't go through enough. And that's where we have to start. If the viscosity is too high, if the peripheral external narrowing of the arteries, the capillaries, is too high, that the body needs a higher pressure. You have to see that. And that's where we start. I never give blood pressure medication. I give remedies that improve microcirculation, which improves the peripheral arterial situations, and the pressure drops automatically. The people who come to us with blood pressure lowering drugs, we can then go into the different forms. We generally get people down to normal pressure in 6 weeks and off the drugs in another 6 to 12 weeks.
When does your high blood pressure start?
It depends on the age and also on the constitution. If you see such a plump, elderly person who is no longer very flexible, the sausage eater, beer drinker type, of course they need more pressure. And if they come with a pressure of 150, then it is already relatively low for their requirements. But when a transparent little grandmother comes along, with such a skinny personality, of course she needs a lot less. And young people should have such good peripheral microcirculation, that they don't need high pressure at all.
We already have the first 16-year-olds who are prescribed antihypertensive drugs because of obesity and the whole issue. Of course, the classic approach is to say, well, then just lose weight, eat healthy. But what other possibilities are there to really support this microcirculation from the outside with methods? How do you do this?
There are various orthomolecular remedies, that means minerals, vitamins, and so on, which already have a pretty good effect. The best known is known even to cardiologists, magnesium. Magnesium makes a slight dilatation of the small vessels, so the circulation gets better. That's one. The second is relatively large amount of drinking. People just don't drink enough. And just drinking, well, drinks which don't come back to you by supporting hypertension.
Welche nicht selber gleich schon wieder zur Hypertonie eine Neigung machen.
Like all the artificial drinks, the sweet drinks, the convenience drinks, the sugary drinks.
Die zuckerhaltigen Getränke.
And an absolutely simple method to immediately improve the blood flow property is staying away from cow's milk products.
Die Blutfließeigenschaft zu verbessern ist weg von den Kuhmilchprodukten.
That's just one. Or we also say away from animal products.
Now there is also the downside. There is also the manager type who now and then allows themselves such a blood pressure medicine in a stressful period. What do you think? What's the point behind that? Why is something like this partially implemented in the positions?
So most of those who do this take beta blockers. Because they feel a certain reassurance and calm, because they probably notice that they no longer meet the requirements and can't keep up with things. That means they have to do an increased adrenaline release in order to meet their professional requirements at all. And adrenaline for a long time, initially it improves fine circulation, but over a longer period of time, after 1, 2, 3 years, the adrenal gland's capacity to produce adrenaline decreases. And norepinephrine, which has a very strong blood pressure increasing effect, then takes over. We also measure this in our patients. The manager who simply or the student before the exam, that's what a lot of people do, who then take Indrel or propranolol or God knows what kind of beta blocker they take. They simply notice that they are more composed, because they have less of that norepinephrine to get excited about.
Sie sind gefasster, weil sie weniger dieses Noradrenaline sich aufregen haben.
And of course that is very beneficial. It's not good for the brain in the long term, it's not good for the organs.
If I am now in a certain unconsciousness with this whole flood of adrenaline and am driven to the edge in my job, do I have the possibility at all to correct this whole imbalance of the adrenal glands, kidney overload, the adrenaline receptors, to reset something like that a bit?
Disbalance der Nebennieren, Nierenüberlastung, die Adrenalinrezeptoren, sowas mal wieder so ein bisschen zu resetten?
That would be the content of 2 more programs. A huge topic. Yes, I think quite a large number of our patients who come to us have exactly this issue. Namely, being overloaded with the adrenergic gene. The adrenal glands can no longer keep up with what people have in terms of requirements in their bodies. And then they are constantly on an overproduction of adrenaline. That comes automatically. And then at some point the adrenal glands drop out. Now we could go straight to long COVID, to burnout, to chronic fatigue. Because these are then the secondary or tertiary consequences of just this situation.
Is it then the point where one or the other speaks of a burnout, or where one falls into this chronic tiredness, where the body tries to regenerate itself? Or how do I recognize it now also in the prevention? Now I have a fulfilling job and kids. I'm doing really well, but always energized. And yet this adrenaline thing and this overload happens in the adrenal gland. Nonetheless, even if you supposedly feel good, how would you approach this preventively? Or even if you say you want to be careful with it and you can't distinguish this positive motivation from this permanent stress level?
At the Sonnenberg Clinic, we have opportunities that go far further than what is normally done at checkups.
als was normalerweise bei Checkups gemacht wird.
Namely, we can test the autonomic nervous system, we can test the sympathetic and the parasympathetic nervous system, which should be in a nice balance.
In einer schönen Balance sein sollte, können wir testen.
We can test this for 48 hours. We also test people's ability to recover at night. Hardly anyone does that. And so we can see, at night, when they should recover, are they also in an adrenergic stress? And can they stand it? Because they first come in a compensation period. Then these are those with norepinephrine, which is another adrenal gland substance, but it has a hypertensive effect. And then they get in there. And the adrenaline drops first. We test this with our patients throughout the day. They then have to make several saliva and urine deliveries. We test that how the adrenal gland works. And that's bad. We have 40-year-olds which are already completely out of compensation. Yes, who is surprised if they then get a bit of COVID or God knows what, an additional stress. And then they get into chronic fatigue. Or long COVID is now fashionable. But there are always such factors behind it. And that's why I say, congratulations dear patient, at least you still have high blood pressure. That means the body can still compensate. But now we have to be careful. Don't just lower your blood pressure. Then the blood circulation in the brain is even worse, and in the adrenal glands. It only gets worse if we lower the blood pressure. No, we need to target the autonomic nervous system and change and improve microcirculation. And then the person no longer needs high blood pressure. And that automatically becomes good. That's why I'm so grateful when I get hypertension patients. We always get them treated.
Great. I have often had the experience that especially in hypertension patients, the wives report when their husbands take the antihypertensive drug that the husbands change. On a psychic level, become more unbalanced, become a bit crazier. What is happening on this level? So it certainly happens in women too. But in this case I often had feedback from wives who said since he has been taking the medication it has been very exhausting.
Yes. So it's like this: people who have high blood pressure medication, so antihypertensive medication, they often have cholesterol-lowering drugs. And the combination with each other is simply fatal. And interestingly, now I'm going to be a bit polarizing, the normal cholesterol levels have been massively reduced. Nobody has normal cholesterol anymore. Everyone gets statins. And the statins, along with the beta blockers, they have really bad side effects. But not tomorrow, but that only starts after a few weeks. And with men who take beta blockers, that's one thing, they simply have less life energy. This is not just sexual energy, but life energy. They are actually more tired then. And beta blockers limit the imagination. These are medicines that reduce the autonomic nervous system, which imparts fantasy, which gives relaxation, which conveys rhythm. All of these things just get flattened out. Not only the blood pressure, but also the nature. And that is the reason, especially the beta blockers do that. The manager notices. Then I won't get so worked up at work. I put up with my boss better and so on. But on the other hand, there is also this indifference or something that has just changed. Beta blockers are really problematic then. But that's not the issue now, the statins. Together they are particularly bad. And then there are the AC inhibitors. This is another group of antihypertensive drugs which is administered often. Today, actually, the more modern ones. And they have a change in mitochondrial oxygen uptake. So the oxygen in the cell, which should provide the energy, is reduced, implemented by these AC inhibitors. And that's really a problem.
What I always found so terrifying, especially when someone had a stroke, that thereafter medication was given across the board, like cholesterol-lowering drugs, although it wasn't even too high. Then just this mix. How do you deal with stroke patients who have now, shall I say, regenerated relatively well? Especially slim men around 60, 70. Do they really have to take this whole drug cocktail?
I can't answer that in general. We also have stroke patients who have residual symptoms or failures, so even with paralysis or speech disorders, facial asymmetries and so on. So still have very bad residual findings. We get very good results because we're doing the same thing again. I activate brain cell activity. We give substances that just give the brain cells which are less supplied with blood, better circulation again, improve oxygenation. And of course we're trying to take away the antihypertensive drugs, because that's exactly the wrong approach. And cholesterol-lowering drugs are extremely problematic. I know they're pretty much always on these drugs, but that only makes long-term problems worse.
So you really need a good doctor who thinks holistically at your side and good support, to really get back out of this whole mess, and the microcirculation seems to be the key to success.
Exactly, the microcirculation is the key, also in stroke patients. The care of the cell is the most important thing, and unfortunately nothing is done about it in academic medicine.
Great. Dear Thomas, thank you for coming. I am very happy. Finally, is there any piece of information you'd like to convey to viewers?
Yes. The patients or the people who are watching now or who is watching this show. Those are the hypertensives, I assume, or their wives. Yes, exactly. And these people really need to do a really holistic assessment of why they have high cholesterol, why they have these hormonal reducers, where the wives have problems with it, or why they have high blood pressure. And you can prove that today. This is modern biological medicine.
Great. All the nicer that you are implementing them in your clinic, and thank you very much for coming today.
Thank you for allowing me to preach.
Dear viewers, I hope with this important topic you were allowed to take as much valuable information with you as I did. Thank you very much for watching. I wish you a wonderful time and see you soon. Bye.